Baseball injuries can derail your season. Here are the ones I see most often. Baseball players deal with a lot of repetitive stress injuries. We still see the occasional traumatic injury like a sprained ankle or pulled hamstring, but the majority of injuries are due to repetitive overuse from hitting and pitching. The most common injuries, as you can think, are going to be shoulder impingement or medial elbow pain. Think of like Tommy John surgery, that's a big one. But here are three that I commonly see with my baseball players that you may not think of. First one, low back strains. Constant hitting, repetitive throwing puts a lot of stress on the lower back. So it's really common that we see lower back strains, the muscle guarding. Usually, if caught early, these are easy to heal, but we still got to manage them conservatively. Number two, hip impingement. A lot of hitting and throwing requires hip mobility. And when we develop imbalances in the muscles, we often see hip pain due to hip impingement. So working on the hips, mobilizing, strengthening where needed can really help with those. Number three is rib subluxation. So think of where the ribs attach to your spine. With repetitive hitting, throwing motions, oftentimes those rib heads actually kind of pop out of place. That's what a subluxation is. So in mild cases, it's just kind of a mild annoyance, a little bit of pain. But in some cases, it can be a really sharp pain, a lot of muscle guarding, a lot of muscle tightness. So these are always something I look for with my baseball players. At Team Elite Chiropractic, we help baseball players recover from these injuries and help prevent them in the first place so you can stay in the game. Dealing with an injury, DM us to book an appointment.